Every week it seems new headlines emerge, warning us about potential dangers lurking in our everyday diets. These headlines often target the very foods we love, the comfort foods, the quick bites, the things we crave. Take bacon, for example, or sugary sodas, those tempting fizzy beverages. And let's not forget the endless array of packaged snacks, often loaded with trans fats and artificial ingredients. For decades, these foods have been under scrutiny, frequently linked to the development of chronic diseases like diabetes, a condition affecting millions worldwide. Then there's heart disease, a leading cause of death globally, and of course cancer, a disease that touches nearly every family in some way. Processed meats, for instance, often contain preservatives like nitrates, which have raised concerns among health experts. Sugary drinks can overload our metabolism, leading to a cascade of negative health effects. And trans fats, commonly found in fried foods, are known to raise bad cholesterol levels, increasing the risk of heart problems. The real concern isn't necessarily indulging in a single treat every now and then, but the cumulative long-term effects of consistently eating these foods on a regular basis. To truly understand the real risks and make informed choices, we need access to large, reliable scientific studies that can cut through the noise and conflicting information. That's precisely what a major new analysis published in Nature Medicine set out to accomplish, offering what appears to be the clearest and most up-to-date picture available as of July 2025. So, let's dive into the details and explore what the latest science reveals about the foods we eat and their impact on our health. Let's take a look at some of the most impactful findings that have emerged from the scientific community. In June 2025, researchers published a sweeping and comprehensive study in the prestigious journal Nature Medicine. This study aimed to provide a clearer picture of the health implications associated with certain dietary choices. This groundbreaking research was generously funded by the Gates Foundation, highlighting the importance of collaborative efforts in advancing our understanding of health and nutrition. To arrive at their conclusions, they meticulously combined data from dozens of independent studies, creating a robust and reliable dataset. This allowed them to accurately measure the health risks associated with the consumption of processed meats, those tempting but often detrimental additions to our plates. Sugary drinks, the sweet beverages that can have a bitter impact on our well-being, and trans fats, the sneaky culprits often lurking in processed foods. The findings revealed that eating about 2 slices of bacon or a single hot dog on a daily basis was linked to a significant 11% higher risk of developing type 2 diabetes, a condition affecting millions worldwide. Furthermore, it also showed a 7% higher risk of colorectal cancer, a serious and potentially life-threatening disease. Regular sugary drink consumption, a common habit for many, raised the risk of diabetes by 8%, and increased the risk of heart disease by 2%, highlighting the detrimental effects of excessive sugar intake. Trans fats, which are still unfortunately found in some processed foods, were tied to a 3% higher risk of developing heart disease, emphasizing the importance of reading food labels carefully. While these numbers may sound relatively small on their own, when considered across millions of individuals, the overall impact on public health becomes undeniably huge. This comprehensive study gives us the most precise and accurate risk estimates we have to date for these commonly consumed foods. But the crucial question remains, just how strong and reliable is this scientific evidence? Let's delve deeper into the methodology and findings to assess the validity of these claims. Despite these numbers, the study rated the evidence as weak or inconsistent. Most nutrition research is observational, tracking what people eat and who gets sick, but it can't prove cause and effect. People who eat more processed meat might also have other unhealthy habits, making it hard to isolate the true risk. Randomized trials would be ideal, but they're nearly impossible for long-term diet studies. So, while the links are real, there's still uncertainty. The key takeaway: don't ignore the findings, but understand their limits. Science is always evolving, and this study is a step toward clearer answers. So, after considering all the information, what actionable steps should you take? It's easy to get lost in the details, but let's break it down into simple, manageable changes you can implement today. The core advice remains simple, and it's a message that's been consistent across numerous studies and expert recommendations. First, limit your intake of processed meats. This includes bacon, deli meats, sausages, and other similar products. Second, reduce or eliminate sugary drinks from your diet. This means sodas, sweetened juices, and other beverages loaded with added sugar. And third, minimize your consumption of trans fats, often found in fried and heavily processed foods. Now, you don't have to cut these items out completely from your diet. Instead, treat them as occasional treats, reserved for special occasions rather than daily staples. Think of it as a conscious choice, not a restriction. Swap bacon for healthier breakfast options like eggs or oatmeal. Choose water over soda to stay hydrated and reduce your sugar intake. And pick healthy fats like olive oil or nuts as your primary sources of dietary fat. Remember, small, consistent changes can significantly lower your risk of chronic disease over time. The new study reinforces what health experts have been saying for years. Prioritize eating more whole, unprocessed foods in your daily diet. Don't fear food or restrict yourself unnecessarily, but eat with awareness and intention. The overwhelming scientific evidence points in one clear direction, that mindful choices made consistently truly matter for your long-term health. This latest research gives us even more reason and stronger validation to stay the course toward better health and a more vibrant, fulfilling life.